Thank you, sir, for coming today, and all the dignitaries who are attending this meeting. Thank you so much for making the time, for our university and for our students. It's a pleasure. A lot of time taken to finally come up with like a concept, get dates, get some free slots, and then today is the day finally. So thank
Thank
you
you.
in advance, and yes, Miss Anuja will set the lecture in motion, and then Stan sir, you can take over, or your team can take over. Is that okay?
Sure. Yeah, it's perfect.
All right. Brilliant, fantastic. Okay, thank you. Thanks once again.
Yep. Thank you, Anuja, for that wonderful introduction. And I would like to start by thanking uh, Dr. Sukshma Sharma for giving us this opportunity. I had an opportunity to visit the Symbiosis University last year in Pune, and I was blown off with the campus that they have and the overall environment that you have in the university. It's very, very empowering, and I got goosebumps when I actually entered the campus, and it was really nice. So I feel all the students who are studying there, maybe a little challenging because of COVID-19, that you might not have your regular classes. But in spite of that, I think the very fact that you're associated with Symbiosis is a matter of pride and honor. So I really compliment all of you for taking this wise decision of getting into health and wellness and a lot of other allied subjects that the university is teaching. And there are two words about it, that Symbiosis today is one of the most premier educational institution, not just in India, but also across the world. So hearty congratulations for that, and for coming up with the innovative ideas to keep your students engaged in various subjects. So coming to straight away to the
Thank
topic.
you. Thank you so much.
Coming straight away to the topic today is that we saw in COVID-19 that people talked about how the frontline warriors actually fought a visible or probably an invisible enemy, but enemy that you probably could experience all around you in the hospital setup, in the healthcare infrastructure that we had in India. So we brag a lot about our soldiers fighting at the border. But the frontline warriors, knowingly that they are at a very high risk, fought the battle, and then of course I think we all need to salute the frontline warriors. Now, to complement that, I think there are a lot of allied professions that are going to have a great future in the next 10 years. When the economy of India was not really doing well, or the GDP was going down. So, people were predicting a lot of different sectors that would come up in the next 10 years. So what I want to really tell is that the next 10 years belong to biotech companies, the companies that work in the field of bioinformatics, the life sciences, or health and wellness companies, along with the technology. I think there's going to be a very strong marriage between these two, sectors. So in this context, the subject of nutrigenomics is taking a lot of relevance, because today people have understood that it's not just about being over dependent on the healthcare industry, but understanding our own physiology, basic human anatomy, and then trying to do basic things in terms of consuming adequate nutrition, and also making a lot of customized lifestyle modifications that are very key to our health in the future. Now, if you see the doctor-patient ratio in India, as for the WHO, it should be 1:1,000 patients, but in India, it's around 1,500. So by 2024, India is targeting to bridge that gap and have more healthcare professionals. But when you talk about nutritionists, qualified nutritionists, the ratio is very, very dismal. I mean, it's 1:1 lakh patients. So that means India is not still woken up to the potential of dietary interventions on their day-to-day, life. There was a survey done by the Hunger Index at the global level, and India ranks 94 within the top 105 countries. So that means we still are of the opinion saying that, okay, get a disease first and then do the treatment, and then, beg, borrow, steal, and, pay from the nose. So that's what the trend is. And this is unfortunately more prevalent among the educated people, not the lower middle class income people. So what we really have come up with is that in the year 2016, we launched Welocity Life Sciences Private Limited, and Welocity Genetics is our brand. And out of that brand, we have now reached out to almost 11,000 people who have done their genetic sequencing, and then based on their genetic report and a lot of their other parameters like their lifestyle, their medications right now, their stress levels, their age, their profession, and everything, our counselors have been able to give them a tailor-made, customized, precision, lifestyle modifications and gene-based diet plan. So I would like to now invite one of our genetic counselors who have done counseling of more than 1,500 distinguished people who are health conscious, and they understand basic, importance of experiencing good health. So I'd like to invite Riddhisha to take us through the basics of nutrigenomics and some of the case studies that we have done. So that will give you a light on what exactly is the work that we are doing. So thanks very much for this wonderful opportunity. Once again, I'd like to thank Dr. Sukshma for arranging this webinar, because these are festive times. I'm sure you must be busy shopping and doing a lot of things. But in spite of that, you're logged in here in an afternoon. So thank you very much. Riddhi, please take over and then share your screen and go ahead with your talk.
Thank you, sir. Thank you so much. And thank you, Sushma ji and Anuja ji, for having me here. All of us, we are so excited to, get all the students on this journey, on this wonderful journey of nutrigenomics. Because, now, if I were to ask you, and I want all the students answering this in the chat box, right?
Yeah,
because
I mean,
fortunately, fortunately or unfortunately, that's the only way we now communicate on Zoom and Google Meet, so virtually. So yeah, use the chat box, and whenever you feel like, sharing something, or maybe when we ask you some questions, you can interact and you can feel free to answer whatever you feel, in your heart, correct? So yeah, so I would like to first ask everybody, what as for you, what is the future of nutrition? Yeah, so if you can just write that one exact word, one word for nutrition practice or nutrition consultation, that's going to take the health industry, it's going to be the next future, and it's actually begun. That journey has already begun. Yeah, so I would like to see a lot of replies, because we have good amount of students here. Yeah, come on, girls. So this reminds me of my college days, but we never had these online webinars. But yeah, we were like so excited to give answers, like even if it was wrong, we always used to raise our hand and give answers. Come on, girls. So what's the future of nutrition? How should a nutrition practice be? How should be, a counselor or as a nutritionist or a dietitian, what you should be keeping in mind while planning a diet or while planning a consultation program? So that's the crux of our today's, discussion. Yeah. So something starting from P. I'll give you a clue. So dash nutrition is the word. Something starting from P. P for parrot. So starting from P. Prevention over cure, Malvika writes. Prevention over cure and diet and medicine. Very good. You're very close, Malvika. But yeah, prevention is not the answer. The prevention is the goal, definitely. But I'm talking about how do we make our nutrition practice? Besides, Purva, you're very close. Purva, you're very close.
Personalized nutrition.
Personalized nutrition.
Very good. Who's that? I would love to see you. Yeah, Richu.
Anu.
I think you both answered together. Hi.
Yeah. And Richu is our colleague on the team. So.
Acha,
yeah.
Okay, great.
Yeah. And Anu is the student who answered that.
Very good, girls. I mean, that's the future, and that's not going to go anywhere. Okay, so when you when you talk about your practice, when you talk about, giving a diet plan to a customer, when you see any customer or a client or a patient, whatever you like to call them, by the way. So whenever we talk to a patient and the patient shares his journey to you, like, I'm suffering from this issue, I'm suffering from that, my family, I have a family history of this, you got to make it personalized. Yeah, so personalized nutrition is the future. And based on that philosophy, we are going to take you towards this exciting journey to this amazing world of something called as nutrigenomics. Yeah, because we are not going to talk about, protein is good for that, vitamin C is good for immunity, calcium is good for your bones. We all know that, correct? But there's something called as personalized and precise nutrition. Precision nutrition is what we call. So that is exactly tailor-made and customized as per your body requirements. But how do we know your body requirement? By doing a BMI, by doing a fat percent analysis. That's very basic. But now what's the future is a genetic test, a DNA test that gives us an understanding, that gives us a brief insight about, what is going on in your body, what genes are you born with, right? So I'll first take you to that. I'll share my screen now. Here, one of you can just acknowledge if you are able to see. 1 second, I'll just. Okay, so is it visible now?
Yes, it is.
Yes, ma'am.
Yeah, okay, great. Thank you so much. All right,
Yes.
so
Nice
this
slides.
is
Yes.
a good, beautiful world called the world of nutrigenomics. Yeah, it's an amazing world when we go into it, and I'm sure a lot of you know about this. Yeah, but this is just like an eye opener for people who do not really have not really ventured into it. Yeah, so as you know, it's made up of two words, nutri and genomics. So genomics is the study of genes, the study of DNA, the study of your blueprint, which you're born with, correct? And nutri is basically, we'll come in, when we'll in the further slides, we'll come to that. But nutri is something that supports your DNA through your eating patterns, through your nutritional levels. I mean, whatever intake you have through your food, it helps you understand and basically help support you in your DNA health, correct? In your health overall. So let's see what happens. So we all know, as medical or paramedical professionals, nutrition professionals, we know that today, I mean, like I just read a sad news right now that somebody, one more, I think, person from the industry, from the entertainment industry just passed away. Very young guy, heart attack. Yeah, what's happening, guys? Isn't it an alarming, scenario? Correct? It is, because we're not taking care of our nutrition, we're not taking care of our dietary habits. So that's the number one cause of deaths and diseases, right? So when we do not take care of what we put in our body, we do not take care of how our body should ideally be functioning, we do not take care of our sleep patterns, all these are top 10 causes of diseases. Number one is
Nidhi,
clearly. Yes, sir?
just to intervene you, when you're
Yeah.
talking about Siddharth having a heart attack,
Yeah.
we are getting a right now news that in Kannada actor Puneet Rajkumar,
Exactly,
who is
I'm
the
just
son of
talking
a
about
great
that.
actor,
Yes, I'm
yeah,
just
so
talking about Mr. Puneet who passed away. I just got I
right
just saw
now,
my WhatsApp.
yeah.
Yes, so that's alarming. And people in the age group of 30 to 40 are the most prone right now because of poor nutrition. Yes, number one reason, we do not know what to eat. Yeah, so when I'm talking about we, when we talk about we, I mean, just assume we're talking about the patients, okay, whether the common crowd, okay. Yeah, so lack of clean drinking water is another problem. The environmental pollution is another problem. Yeah, no physical activity. You see the girl on the screen, yeah, she's gained weight because she's a couch potato, right? So our lives are basically, they are becoming, remote controlled. Like even now, on, there are so many apps on your phone, there are so many softwares. We have Alexa, we have Siri, and all those doing the work for us, right? But we need to get up and, we need to get up from that couch and do our own work. So that's basically a very sad state today. We are technologically very, moving forward, but yes, health-wise, we are not We're not doing that, correct? Then there's lack of adequate sleep, overweight, obesity, mental health, an alarming rise in mental health cases. Yeah, primarily due to stress, correct? Then there are addictions, infections, and the use of drugs or chemicals, right? So that's the top 10 causes of disease. Apart from that, there are some other disease, other events like accidents and all that, which come, way beyond these 10 cases, right?
Riddhi, sorry to
So,
interrupt.
yeah,
Can you make
yes, ma'am.
it full screen?
Yeah, it is full screen. You're not able to see that?
I
One
think,
second.
Riddhi, your
One second.
presentation is stuck. We are still on the
Yeah,
first slide.
Oh,
Riddhi, your
okay,
slide
okay.
is not moving also.
Yeah, refresh
Slide
it.
is not moving.
Is it fine now? Did you see the next slide?
Share again.
Okay, one second.
Stop share and share again. Probably
Yeah,
that will help.
yeah. Now is it fine?
No, we can't see the
Can't see.
Not yet.
Screen is
Not
not
yet.
screen is not up yet, Riddhi.
Okay. All right. Just one second. Now, are you able to see?
No.
Not sure. One second. Huh? Can you see now?
Yes.
Yes.
Yeah.
Yes.
Okay.
Yes.
I'll just do the slideshow. Let me know if that is visible. Yeah. Is it visible now?
Yes.
Okay.
But
The maximized screen, right?
still not.
Not?
Still not
Can
full
you just
screen.
press the book mode, the icon just next to the slide?
Okay, one second. Yeah, the book mode here. All right.
Yeah,
This?
perfect. Yes, absolutely.
All right.
Yes. Thank you so much. Thank you. Perfect.
And then I have to
Please
just
continue.
okay,
Yeah.
yeah. So these are the top
Thank you.
10 causes as I just discussed, correct? So we'll move ahead and we'll see what do we do next, yeah? So Hippocrates, the father of medicine, said that let food be thy medicine. But do we do that in reality? No, right? I mean, most of the times it happens that we have a pain in our, cervical region, we have a pain in our back, we have a headache, we just pop a pill, correct? Because that's instant. No doubts about that. Yeah. So I'm not saying allopathy is bad. I'm just saying that if you make your internal environment, healthy and balanced and nourished, you will not get such problems. So prevention, yes, comes into picture over here. So your food can basically cure you in many ways. Yeah. So we'll see that. So on the left hand side, if you see, I'm sure, I hope it's gone to the next slide. Yeah. One of you can just acknowledge that. Yeah.
Yes, absolutely.
Okay, great. So now it's working fine. All right. So on the left side, you see that's the old model of healthcare, which was reactive. Reactive, yani ki, whenever a problem arises, we give a solution. Yeah. There was, there was a lot of focus on disease management. I mean, when after the problem has occurred, after the health illness has come in, then you manage it. Then there was generalized, like, one pill for all of them, correct? Or one food for all of them. Like protein will help you to do this. Calcium will help you to do this. Yeah. Costly. It was very, very costlier earlier because of the, lack of evidence, lack of science, and, sticking to only one solution. So that is why old model of healthcare did not work effectively. Then we switched over to the new model of healthcare now in this century, which is more proactive. Proactive, yani ki, you are taking care of a lot of factors which will, which will not make you wait after the illness has occurred. Yeah. Second is preventive. You're making sure that you prevent illness and nip it in the bud. Correct. Then there is personalized. So it's not generalized. It's tailor-made diets now, customized diets. So that there's nothing called as one size fits all. Yeah. And there is a predictive approach towards our healthcare. So, you are predicting, and our the nutrigenomics world comes from a predictive kind of a philosophy, right? You predict what you're going to get, correct? So what do we do at Velocity? I'll quickly go through this. So this is an SOP that we follow here. The first is a DNA kit that you need to buy. Okay, so there's a saliva sample collection kit. So there's a small kit which comes with a tube and which also has a small liquid to preserve that DNA. Okay, so we all know that DNA is present in all cells of our body. Correct? Hair. Ma'am, can you mute like somebody is speaking in the background? Yeah. Okay. So yeah. So our saliva has DNA as well, correct? And it's the most non-invasive way of collecting DNA. I mean, as compared to taking a blood sample. So blood sample would require you to use a needle and a syringe and take out the bloods, which is invasive. But here saliva is always there in our mouth, so we just spit it. How do we do that? So yeah, we do send the kit to your home, or you can purchase it from the nearest Velocity center, correct? So there's, as I said, there is this tube. You spit into that tube, and there is a sample collection process also. There's a video for that, which if time permits we can play that. Okay. And then after your saliva goes to the lab, in this tube, you send it to the office again. The office sends it to the lab. And then after that, after a few days, the report is generated based on your DNA. Yeah, so there is the sequencing that is done, DNA profile that is done, and a genetic report is procured, which is a very detailed report about what your genotype is and what are the recommendations that we give you as per your genetic risks that have come in the report, right? So that is emailed or WhatsApp to you. Then happens your genetic counseling. So nutrigenetic counseling is basically kept done by keeping in mind a lot of factors: your health conditions, your lifestyle, current lifestyle that you're living, your genetic report, of course, and then we offer a solution in the genetic counseling. So it's a 1 hour informative genetic counseling on phone or on video call, right? After that, there is a gene-based action plan. So now that we have discussed, okay, hey, Mr. Sharma, you have a risk of, gluten intolerance. You have a risk of vitamin B12 deficiency, and probably that's why you're frequently getting mouth ulcers. Yeah, so we come into conclusion a lot of insights that are coming forward in the counseling, correct? So after that, what has to be done by the client is given in the action plan, based on the lifestyle as well as the genetic report. Yeah. After that, if there is any issue that the patient is facing, any queries, any doubts, he can get back to us. We have a help desk assistance, and then we also have gene banking facility. Gene banking is nothing but we store your DNA in case in the future if you want to do any new tests or any further upcoming activities with the DNA, we can do that. Yeah. So understanding the terminology is very, very important. So now I'm coming to the report. Okay, so before we go into the report, like I would like you to have a glimpse of the Velocity report. Before we go into that, we need to understand what are these codings. Okay, the codings. Yeah, hello. Okay, so yes, so we need to understand what are these smileys in the report, okay, because that's the next slide that you're going to see. So if you see a light blue colored normal risk smiley, it means there is no impact or no effect of a particular food or a particular intervention on that particular phenotype. So phenotype is nothing but your trait or your characteristic, and genotype is something that you're born with. So neutral smiley, no harm, no benefit. कुछ भी नहीं होगा, ना नुकसान होगा ना फायदा होगा. Yeah. Then the low risk one says that you have a less risk of that particular disease, or you can say that is beneficial for you, so you can take that. Okay. Then comes moderate risk, which is denoted by a yellow smiley. So that's a medium risk of disease, or not a really high risk of disease, but the risk is still there. So around 40 to 60% risk is still there. And then there is a high risk, which means there is an increased risk of disease, and you need to pay attention strictly to your do's and don'ts that the counselor tells you, that the nutrigenomic counselor advises you. Yeah, so let's have a look in the report. Yeah, so we have around 210 tests that we do. So that's quite a huge number of, that gives you brief, complete detailed insight about your body that you're born with. So once you're conceived in your mother's womb, you get those genes from your parents, correct? So right from that time till your death, the genes are not going to change. We all know this science, correct, of genetics, basically. But we need to see where we can work on based on the risk smileys that you see here. Yeah. So the first the first category that we talk about is the nutrient deficiency risk. Okay. So if you see here, so we have vitamin A deficiency, B2 deficiency, B6 deficiency, B9, B12, C, vitamin D. How is your response to vitamin E deficiency? So this is in response to abdominal obesity. So you have many clients, you have many patients who have the central obesity, correct? So that's the number one reason for heart attacks also. Yeah. So we need to take care of your vitamin E intake, then your calcium requirement, iron deficiency, and many more. So you need to see why a person is frequently getting vitamin B12 deficient. Why is he falling below his normal hemoglobin levels? Why is the bone density so bad for this particular woman? So we get an insight from this. Yeah. So if you have a higher risk of calcium deficiency, for example, you need to replenish your calcium stores very often, and we need to pay a special attention to the diet and supplementation. Yeah. Then comes food intolerances. So basically, we all have heard of these gluten, lactose, caffeine as potential threats to our system, because if they are not digested in your body, they can create severe and major health disturbances. We'll see those in the case studies, and you will see an alarming effect of these intolerances. Yeah. So food intolerances are not a fad, by the way. They are for real, and we have seen them in our patients. Yeah. So gluten intolerance, lactose intolerance, blood pressure, and heart attack response to caffeine, because they say that, research suggests that when you're carrying a mutation in your CYP1A2 gene, a cytochrome P450 gene, when you have a mutation in that gene, you cannot metabolize caffeine the way somebody else would be able to do. Right? So you are a slow metabolizer of caffeine, and that can lead to blood pressure and heart attack. Same goes with sodium. So if you're very sensitive to salt, even little intake can disturb your cardiac output. Yeah. The next is weight management category. So we have obesity risk. Then why a person is not able to, so many times it happens that patients come to us, they ask for our advice, and then we give them a diet plan. We do everything, but that person doesn't seem to lose weight at all. Yeah. हम कितना मेहनत करते हैं उसके पीछे. The person, poor thing, he also does so much of hard work, right? But something somewhere does not work in his case. What is that? So we come to know exactly in the weight management category. Then we have, so if you see this, there's something alarming here, appetite response to ginger supplementation. Yeah, so studies have shown that ginger in any form, whether dry form or in a fresh form, if given to people who have this kind of a genotype, this person is beneficial. See, this, whoever this report is, uske liye ye fayda karega. So if he is on a weight loss journey, please give him a ginger supplement like salt powder or fresh ginger in water or whatever, right? So we get to know exactly what will work for him. So it's not R&D that we are doing on the patient. Yeah. We know exactly what to do. Then comes diabetes. So what is his risk of getting diabetes, whether it runs in his genes? Will fiber be beneficial, or will it be not, right? So all these are taken care of. Then comes your thyroid health. So how is your risk of thyroiditis? How is your risk of hypothyroidism, Graves' disease? All that affects your thyroid. Yeah. Cardiac health, cholesterol and lipid profile. Aapka kitna chance hai? How much are you predisposed to getting cholesterol in your lifetime? How often, how much are you at a risk of hypertension? Because see, now this is a silent killer. You will not come to know that you have hypertension unless and until, a lot of damage has happened, correct? So then And obviously, unless and until a patient checks it, goes to a doctor and really checks it proactively, right? So, वो normally be sweat कर रहा है and he's having palpitations, he will not understand that this is hypertension. He will be like, oh, I have exerted, that's why. So it's a silent killer, right? Then comes your, one very important test we do is hyperhomocystinemia here in the cardiac section itself, because if you're homocysteine, if you're genetically predisposed to higher homocysteine levels, that can lead to heart attacks, that can lead to Alzheimer's, Parkinson's, that can also lead to a lot of other autoimmune conditions and inflammatory conditions. Yeah. So we check all that, atherosclerosis, heart attack, coronary artery disease, all that. Cancer risk, we check your risk for cancer as well. So if you're at a higher risk, we don't have to scare the patient that, look, you have a cancer risk. Now what? So now what? We are there for that. We have to give them solutions. Yeah, we have to tell them what will be, what will be the cause of your oxidative stress or your free radical damage, and what will stop the cancer cells from growing. Okay, so all that is basically helping you in personalizing the nutrition plan. Then comes organ health. So gallstone predisposition, or there is fatty liver, there is hyperuricemia, there is gout. Okay, so glaucoma, cataract, age related hearing loss. Yeah, all this is basically covered here. Inflammatory diseases, so there are inflammatory conditions like asthma. Then there is pain sensitivity, septic shock. Some people have frequent colds. As soon as the weather changes, they start, with a running nose. So that's allergic rhinitis. Yeah, rheumatoid arthritis. All this comes under inflammation. Neurological health will cover all your Alzheimer's, schizophrenia, Parkinson's, pesticide exposure response, migraine, ADHD as well. Yeah, and then, sorry, is it stuck? Huh. Yeah, so then there is eating disorders and addiction risk. So some people are genetically predisposed to, some people are genetically predisposed to addictions, that runs in their family. Like, even if they are not smoking, there is a high chance that in the future they might, yeah, because these run in the genes actually. And obviously, environment also has an influence, but genetic influence also cannot be neglected. Correct. So then there are addiction towards drugs, smoking, anxiety disorder risk, eating disorders, personality disorder, all these psychological conditions as well. Eating disorders, so very, very important for nutritionists to understand whether a patient has an eating disorder or no, has a genetic risk of it. No. Yeah. Then comes your gender specific risks. So if it's a male, then how are the risk of, so this particular guy was a male, so we had the risk denoting it as typical risk, so not really a high risk. Okay, if it's a female, so then we have PCOS, risk of PCOS, risk of infertility, risk of abnormal pregnancy, miscarriages, all that we check. Yeah. All right, there's something called as alopecia areata that can happen in males and females both. Yeah, so it is basically losing hair in patches. I'll show you a case study for that. Okay, and then we'll discuss what did we do for that. Yeah, then there is something called as, you all know, right? When we consume we inhale a lot of polluted air. We inhale a lot of, we consume a lot of food that is stored in plastics. Then those bottled water and all, they are very toxic to your health. They can damage your DNA as well. Correct. But what about tandoori food? Did you know that? Yeah. So lot of studies are now coming up saying that tandoori food can also destroy your DNA basically. Yeah, because it is nothing but charred meat, charred food. So you have some chemicals, HCAs and all that are working, to damage the DNA, right? Then comes your drug response. Now, many a times a patient comes to us and says that, I've been given a hypertensive drug, Telma or whatever, and that's not working for me, doctor. So I need a diet from you. Yeah. So why is that not working? Did you ever think of it? Yeah. So that could have a genetic connection. So if you are using statins to lower your cholesterol, you need to know that the person is a weak responder to atorvastatin. So you can give him lifestyle corrections, like you can give him some soluble fiber foods. You can give him a lot of other foods to, reduce the cholesterol naturally. So not really making the person dependent on medication, yeah, because he has a weak response towards that, right? Then comes antidepressants, how is his response, and all those things, yeah. And lastly, we also dive into fitness. We also check the fitness response that a person is born with. So some people like me, I cannot do weight training. It gives me a bad muscle sprain. Okay, so I've tried that 2-3 times and I've given up. So why is that? Because in my genetic report, it came that, my genetic report says that I need to do more of endurance. I'm made to do endurance activities. So whenever I walk or whenever I, run on the treadmill, I lose weight wonderfully. But when I do exercise, as in the weight training, I'm not able to successfully do it. Yeah, so that's the answer lies in your genes, surprisingly. You know? So all this is very, very important to chalk out a personalized diet plan. Yeah. So what is nutrigenomics? Now that's the report that I showed you, but now what? So it's basically a scientific study of how food or how nutrition in the food that we consume on a daily basis will help to, either support or not support the genes that we are born with, right? So that's what we are going to see. It's the latest scientific breakthrough that helps us stay healthy through diet and exercise. And not just diet and exercise, you'll see a lot of other factors ahead. Yeah. Okay. So the difference, so although, the umbrella term for nutrigenetics or nutrigenomics is nutrigenomics, so we collectively call it as nutrigenomics because that's a science of, studying how food affects your genes. But we need to understand very closely a very thin line between them. Okay, I'll explain that with the help of an example. So let's say nutrigenetics is a science wherein you study how your genes will affect how your body responds to food. I'll give you an example. So if you see the first one, the top one, I'll give you an example for this. So I have a particular mutation in my gene here, let's say in the MC-M6 gene. Okay, so that's a gene which is responsible for secreting the enzyme lactase. Okay, lactase, now what do you understand from lactase? It is the enzyme that breaks down lactose from milk. Okay, so I have a problem with MC-M6 gene. So nutrigenetics will tell me that this particular genetic mutation is causing lactose intolerance. I'm not able to digest dairy. With the moment I have milk, I puke out. The moment I have milk, I have to visit the washroom because I get severe IBS issues. I get severe diarrhea. Some people get constipation. So you need to understand the underlying cause in your genetic structure, right? So MC-M6 gene is responsible for lactose intolerance because you cannot make the enzyme lactase otherwise if there is a mutation. So that is an example of nutrigenetics. I'll give you an example of nutrigenomics now. Now the lower portion, okay? What you eat affects how your genes behave. So let's take an example of spinach. Palak, yeah, not many people like, but yes, we need to have it because of the excellent nutritive value that it has to offer. Now we all know palak mein kya hota hai, palak mein iron hota hai, palak mein vitamin A hota hai, and of course there is folic acid in the natural form called folate. Yeah, so we're going to talk about folate here, vitamin B9. Now, a lot of us know folate along with B12, they both carry out a very important function in our body. That's called methylation. Yeah, so the methylation cycle, what does it do? It stops you from getting heart attacks. The number one killer today. So the number one killer is not coronavirus. It's still heart attack. Yeah. So, people do not eat folate enough in their diets. Yeah. So spinach is something that gives you vitamin B9. So I'm giving an example of nutrigenomics here. So when I eat spinach and I know that there is a genetic mutation in my MTHFR gene, so that's a methylene tetrahydrofolate reductase gene, so that's shortened for MTHFR. When I consume palak on a regular basis, I'm just giving an example of palak here. There are many foods that contain folate, but that's the best, as we know. So something to signify folate is spinach. Yeah. So when I do that, when I eat spinach, I am taking a control over my genes. something which will not happen, which cannot happen otherwise. ना मैं अपने genes को change तो नहीं कर सकती हूँ. I cannot change the structure, the inheritance that I'm born with. Correct, but I can definitely silence it. So that's where nutrigenetics and nutrigenomics come into picture. Yeah, so DNA is never your destiny. A lot of people, like, we always say, that I'm born with a cancer gene and I'm going to get cancer in my lifetime. No, it's not your destiny. A lot of years ago, like, when this research was happening, the researchers came up with something called as epigenetics, something else that works on top of your DNA. DNA does not mean that you're doomed. You're doomed for life to get cancer or Alzheimer's or Parkinson's. Yeah. So there's something called as epigenetics. Epigenetics is nothing but something over and above genetics that will help you in controlling your genetic makeup. Yeah. So there's something called as genetic expression. So what is that? Expression is nothing but to come forward or to express itself, right? We understand that meaning of the word, correct? The genetic expression, I'll give you an example here. It is a tightly regulated process, like how we have a switch for, switching on the light, switching off the light, switching off it. Yeah. So it's like that switch. So whenever I'll come back to that example now. Whenever you have spinach, I know I have a mutation in my MTHFR gene. I can get heart attacks, I can get Alzheimer's if I don't take care. So I have spinach in my diet, I have beans in my diet, I have fruits in my diet, which are folate rich. So I know that this is going to switch off the gene for all these diseases that I just listed. Yeah, so let's take an example of the obesity gene. Okay, a lot of obesity, every third patient you must be handling must be a weight loss patient, correct? So let's say there are these switches. It is signified by the ऐसा कोई switch नहीं होता है, by the way. So there are these epigenetic tags that we have. Okay. So let's take an example of the FTO gene. Okay, the FTO gene is responsible it determines your risk of obesity. Whether in the entire lifespan you will ever you will ever gain weight, and how will your weight loss journey will be. Yeah. So for example, now let's look at, so this is genetics, now. Obesity, the FTO gene we are talking about is genetics. Now we'll talk about epigenetics. So epigenetics is nothing but your environment, your lifestyle, your food habits, etc. Correct? Let's say if I consume a fresh fruit, vegetable, balanced diet, yeah, so I'm going to switch off the gene. The FTO gene is going to switch off, and I will never able to. I'll be I'll be making sure that I don't gain weight, right? But on the other hand, if I consume junk food, it will switch on the gene. So that's called genetic expression. Yeah, so it's a regulated process. So this cannot be changed. Genetics cannot be changed, but epigenetics can be changed. So that's where we step in as nutritionists, as dietitians, as health coaches, health professionals, doctors. All of us work together to control our epigenetic factors and make them the best. Yeah, so we advise the patient to go on a lifestyle modification, because we know that genetics load the gun, but lifestyle, it's the lifestyle that pulls the trigger. आपको गोली तब लगेगी, आपको गन लोड करने में नहीं लगेगी, आपको ट्रिगर पुल करने में गोली लगेगी, right? So that's where lifestyle comes into picture. It comprises of nutrition, fresh air and sunlight. People ignore the importance of sunlight, especially in metro cities, in cities, especially like fast cities like Mumbai, Pune, and Bangalore and all that. Who has the time to get sunlight? Get ready and go to office, go in your car or your public transport. Nobody has time. So exercise, sleep, emotional health, all that comes into your epigenetic or your lifestyle factors, right? So that comprise of your healthy lifestyle. So no alcohol, no smoking, alcohol in moderation, no smoking, junk food intake has to be controlled, your emotional health has to be, taken care of, all these things, right? So I hope you understood by now.
Riddhi, can I
Yes,
just intervene? Okay,
yeah.
so we are at around 250.
Yeah.
So we got to, get to the testimony a little faster.
Yes, sir. I'll do that.
Yeah.
Don't worry. Okay. So we're coming towards the testimonies only now. So if you want to see how it looks, we've been talking about personalized nutrition, right? If you want to know how does it look, let's look at these case studies. The first one, not a good site, but you'll have to see that. Sorry, please bear with me. So that's called onychomycosis, which is a fungal infection of the nails. Okay, so this patient before genetic test had this severe condition. After doing the genetic test, after taking the interventions, you can see the effect of that particular, of the intervention basically. So let's also discuss what happened in her case. Yeah, so she had a high risk of MTHFR mutation. So this is what I'm talking about, her genetic report. Okay, so she had a mutation in the MTHFR gene. We just discussed some time back. She had a risk of gluten intolerance. She had a lactose intolerance risk. She was high on dairy. By the way, she was like, she had a lot of dairy products in her diet. Inflammation risk moderate था उनका. Vitamin B12 and B9 deficiency moderate risk आया था उनका, right? So what were the interventions that we did? Elimination of wheat and milk products, right, from the diet. The first thing that we'll do is, when we come to know that you have a gluten and lactose intolerance, we will have to take out these two things. The dairy and the wheat group go out. So wheat group will comprise of suji, dalia, of course, gehu, maida, everything. Yeah. Probiotics, because she needs repairing of the gut. Already there is an autoimmune kind of a symptom that has happened. Now you need to repair the gut. So we gave them curd, which is, by the way, curd does not contain a lot of lactose. It has lactic acid, correct? And apart from that, we also gave her the other probiotics that we have in supplements. Anti-inflammatory foods to reduce inflammation. So curcumin, omega-3s, a lot of antioxidant-rich fruits and vegetables, a well-balanced diet, because if she needs to grow new skin, right? Biotin supplement, because nails ke liye biotin is very, very important. Also de-stressing activities, because this is also a kind of an autoimmune condition. So stress is an underlying cause of autoimmune diseases. Yeah. So we gave her yoga, meditation, and something called as guided relaxation. You must have heard of this term called Yog Nidra, right? So that's a very good solution to manage the stress levels. Hygiene practices. She needs to cut off her nails and everything, and she needs to be very, very hygienic. Yeah. Second is alopecia areata, again an autoimmune disorder. So as I was talking about patchy hair loss previously. Yeah. So this is a case of a 14-year-old boy, not very confident because of the condition he's dealing with. Yeah, after DNA test, now get ready for the miracle. Okay, so he had a head full of hair. Yeah, which was so miraculously done through lifestyle interventions. Yeah, I mean, it is hard to believe, but it is the case. Yeah, we have done a video conferencing with the boy, right? Okay. So what happened was MTHFR mutation. Now this is #1 reason for a lot of autoimmune diseases, by the way. Vitamin B12 and B9 deficiency, gluten intolerance risk, inflammation risk. Something that I discussed, hyperhomocysteinemia. So homocysteine levels increase because your B12 levels go down. Yeah. So what was done in his case? B12 and B9 rich foods. Now supplements which have B12 and B9. You make very sure that you use the right kind of supplement. So there's something called as cyanocobalamin. There's something called as methylcobalamin. Always make sure wherever there is a vitamin B12 deficiency risk, you give methylcobalamin, because that's the most biologically active form. Yeah. Methylfolate, again, the same thing for B9. Give the L-methylfolate form of folic acid supplement to support the methylation process. Antioxidants to reduce oxidative stress. He had a high risk of oxidative stress. Wheat was eliminated. Probiotics were given to repair the gut. Anti-inflammatory foods were given. Protein to support hair growth, because he needs to grow new hair. Biotin, again, to support hair growth, right? Weight loss testimonies are a lot. I mean, we have seen amazing transformations. Yeah, so from here to there, from fat to fit, how did that happen? That happened with, by closely studying the genetic profile, especially in the weight management category. The person had a very good response to PUFA. So the moment, what does this mean? This means that if I give him an omega-3 supplement or a PUFA rich food, he will start losing weight. Yeah, so all that comes in your genetic report. Poor satiety response. We had to work on a satiety. I mean, you need to make sure that the person does not overeat, right? And what are the tricks and tips and tricks that you will give him to control his satiety? All that is there. Gluten, lactose, all that. So obviously the lifestyle interventions where all these well balanced diet, pufa in the diet, dry ginger powder, because he was a good responder to ginger supplementation. I just showed you in the report, there is a phenotype for that, correct? So we had to give him, his body completely accepted that, and he lost weight in a very good span. And yes, daily physical activity, which the person was okay with doing brisk walking only, so he did that, but definitely gave him a good result. And of course, mindful eating techniques. Yeah. Okay, so the next testimony you see is of Stan Sir himself. So nothing, who else better than him to give you that testimony, right? So we'll hear from him shortly. So other testimonies also included that, a girl, a lady of 35 years suffered from asthma since 6 years. She had to be dependent on the nebulizer, on the inhaler basically. And now if you can see here, that's a testimony from her. She gained back her health by eliminating certain foods, and obviously also she had a, risk of a lot of nutrients, so B12 and D especially, okay? And vitamin D is linked to asthma, vitamin D deficiency. So she's off the inhaler now. Isn't that wonderful? Yeah. Secondly, see, now it makes us so happy to share these, because the person is happy, the person is not dependent on medication, the person is valuing nutrition so much that, array, this is my savior. Nutrition is my savior. But what made the change here was, what was a game changer is that personalized nutrition is a savior, right? So here there was a problem of tinnitus, that is that ringing sensation in a ear, correct? Hypertension. This person was on hypertensives, and after doing a lot of lifestyle interventions, like even meditation, yeah, water intake, exercise, sleep timings, meal timings, everything was changed. Gluten-free diet was prescribed. His blood pressure also dropped, and not only that, his medications were tapered, and ultimately he's now off medications. So that's what is happiness basically. Yeah. And then there is one lady who had arthritis. She couldn't get up. Yeah. And she was a homemaker, but couldn't do any household work. So now that she has followed all the interventions with the beautiful help of nutrigenetics, she has now got the results, and see what she has to say. I'm able to go walking to the temple and also work like normal without any body ache. So all the time we always think कि अरे ये दवाई से ठीक हो जाएगा, but also see the possibilities that nutrition has to offer you, correct? So yes, I skipped one. So we have a mission. Yeah, so we have a mission of creating wellness professionals, genomic wellness professionals in the society, so that they can help a lot of people. And we want to build a community wherein any person that comes to us does not go away unhappy or just ill basically. Yeah, so we want to convert illness to wellness, and that's why we need a lot of people like-minded and enthusiastic people, young people, like all these girls sitting out there. So that's why we have this division in Welocity Genetics called the WIGNET. It's called the Welocity Institute of Genomics, Nutrition and Entrepreneurship Training. So yeah, I would like to sign off by saying I hope I was very audible, clear, and I was able to do that very well. I hope you understood it very well. So I would like to say leave by saying that Anne Wigmore says, and I'm sure every nutritionist swears by it. Yeah. So the food you eat can either be the safest and the most powerful form of medicine, or it could be the slowest form of poison as well. It all depends on what you eat. It all depends, on what your genetic makeup is. Yeah. So a warm thank you to all of you for listening to me patiently, and I hand over to Stan. So thank you.
Wonderful, wonderful.
Yeah, thank you, Riddhi. I think you've been not just passionate, but also very elaborate. So we are at around 3 o'clock, 3:02 in fact. So we'll open up for some questions if you have. And along with Riddhi, I want to also acknowledge our nutrigenomic counselors. We have Reena Baliga, you have Lavina Cardoza, and we have Rhea Doshi. Rhea Doshi also has been working with us for too long, and she has counseled more than 1,000 patients and the customers herself. So all of them have counseled. I mean, some of our customers are ex-president of India, Pratibha Patil, and her entire family. Shri Ravi Shankar, a lot of Bollywood people, a lot of cricketers, a lot of politicians. Yesterday we counseled the revenue minister of a state. So a lot of people who understand the importance of the health, the wealth of health, because it's very easy to claim saying that, look, I've got medical insurance, I know the best of doctors, I know I've got a lot of influence in the premium hospitals. But when it comes to that critical moment, people actually regret as to, oh, I could have done that and I should have done that. So we try to predict the risk factors and then give them a solution much ahead than what they could create a negative impact. So if there are questions, we could answer. How would you like to go about that? Dr. Sukshma, you would like to monitor that?
Yes, definitely. I think it was such an impressive talk and insightful talk and very explicit in, explaining the basic concepts. I think that would be really helpful for all of students. I'm very confident of that. And I think what we would like to be interested, I'm sure the students would ask you is regarding the internship opportunities and the scope of employment. So if you could just cover that, it would be helpful.
Sure. In fact, there have been a few students who have done internship with us from Symbiosis University in the previous years as well. Though in the last 1.5 years we had this challenge of COVID, so the last batch actually was a little awkward in the sense that there was face-to-face interactions as well. Then we had to shift to the digital mode, so students all left to their respective cities. So what we actually did is the academics that we all study in the university campus is mixed or rather blended with a practical industry experience of face off with the real patients, their lifestyle conditions, the trauma that they're going through a lot of chronic diseases, and then the ordeal of going for a lot of pathies. Like, they start with allopathy, then they go to homeopathy, then they go to so many pathies, and they're a little hopeless. And a lot of those people consider genetics, saying that, okay, look, I've tried everything. Now let me see if I get some breakthrough solutions here. And that's where we try to integrate everything, not just their underlying medications and they're taking, but also there are a lot of underlying conditions like their lifestyle, which probably the mainstream healthcare does not really pay a lot of attention to. So that's where they get breakthroughs and very good results. So we have solved some very complicated cases. So all the students who after their academics will have an exposure to interact with these kind of people, and it's going to be like a lot of real case studies. You can get to know a lot of students, the patients, and understand their conditions, and our nutrigenomic counselors will be able to give you the science behind, let's say, a gene-based diet plan, and then your calorie calculations. And that is done considering a lot of factors like your food intolerances. You can't be recommending 2,000 calorie to a person and giving them a lot of rotis and chapatis if you are neglecting gluten intolerance. So when you have that kind of an insight, your diet plan is going to be probably still 2,000 calories, but then your intake or the ingredients will drastically change, and that brings the results. So we have that opportunity to have internship. I'm sure through you, people can approach us, and then we'll explain to them the formalities of doing a internship for maybe 2 or 3 months. That's definitely going to give them a good exposure.
That would be brilliant. I think that would be really, refining their skills further. The counseling skills, blending of academics and application levels. I think that's going to work for them. Also, guidance of reading those reports, which are so impressively explained. I think in the PPT. To be honest, it's the first time I'm seeing those, those smiley kind of a format, which is actually very. In my opinion, it's so helpful, right? So even a layman can actually, read it and can know whether he's at a higher risk or at a lower risk. And, it's so, they don't need a professional to explain it. And I think that's like half the battle won, right? So, really, that's really a good way of going through. So
Yeah,
I think these
I
will
just want to
be,
intervene there,
yeah,
Dr.
that's fine.
Shukshma, is that, to understand in a very layman language, we tell people saying that we give you the GPS of leading a healthy life.
Yeah, I
Uh,
think that's good. I think that's a
yeah,
good term you're using. I think that's really, what people need right now. And like how you all said at the start of the seminars, that I think nutrigenomics is the way to go. And I think our country needs to put more emphasis on it
true.
and, scientifically go further in the field of nutritional science with epigenetics, so to say, right? Okay,
Absolutely,
so
yeah.
do we have any questions from students? Any questions, any doubts,
The
anything you can think of?
students must be hungry if they had not had their lunch.
So I hope not. Any questions, students? Do you have any questions? Okay. No. All
Okay.
right. So anyone else? Anuja ma'am, do you have any questions related to nutrigenomics subject or anything like that?
Hi, Sushma. Actually, recently started, and nutrigenomics is such a subject that puts you in awe. Actually, like, what is this? I mean, things, your tiny genes can change your
Yeah.
entire life, literally.
Yeah.
Yeah,
Yeah.
it's quite
Absolutely.
interesting. Um, and I don't have a question. Actually, I was just looking for the Wignet, basically, the Velocity Institute of Genomics. So I was
Yeah.
trying to see the syllabus. I mean, I was just trying to see what is the course and what are all subjects that are included. But for some reason, my laptop has ditched me today and it is not showing me anything. Yeah, so I was
That's
just
Yeah,
fine.
yeah.
Could you expand more on Wignet? Then I think we would
yeah,
like to know
I
more of
can explain
Wignet
that very
things.
quickly.
Yeah.
There's a little echo that's coming. Okay. Someone has to go on mute. Okay, fine. So, yeah, see, Wignet stands for three important things: nutrition, genetics, and also entrepreneurship. Because you're having a lot of academic knowledge is not going to benefit you if you're not putting that into an entrepreneurship business model. And today is the time for startups. So, a lot of young entrepreneurs need to really consider to build a career in this. So that's where we orient them. So we cover fundamentally four aspects in this course. The CCNG is certificate course in nutrigenomics. Though we are talking about nutrigenomics, we are fundamentally talking about basics of nutrition, basics of genetics. So there are 12 chapters that talk about the history and so many other things. Then another 12 chapters talk about the fundamentals of nutrition. So we talk about macronutrients, micronutrients, the water, which is as a forgotten nutrient, so many other subjects. Then we have the marriage between the genetics and the nutrition in a section called nutrigenomics. So how it's going to help, customize it for your requirement of your body. And then we get into another section called the science of epigenetics. That's taking a lot of importance right now. Globally, there's a lot of attentions on epigenetics because most of our diseases today are lifestyle induced. 80% of our people are dying probably out of organ failure, multiple organ failure, because of the erratic lifestyle, whether it's nutrition or overdose of medicine or sleeping patterns going for a toss. The BPO industry, the call center industries are working at exactly the opposite of the circadian rhythm, and people today have PCOS, infertility, and so many other issues which were not there 20, 30 years before. And then in the fifth section, we are going to actually talk about a report as to how to interpret it, what are the things that you need to consider, and then how to curate an action plan, which you need to know multiple factors to do this. So it's a 2 months course. We have 8 classes of 2 hours each online. In fact, today was the last class, eighth class of our fifth batch of, batch 5 of CCNG. Very interestingly, we also will be launching a course called Certificate Course in Pharmacogenomics. This will be aimed at the medical doctors, because today ADR, or the adverse drug reaction, is the number one killer across the world. And today people, even before you listen to, a doctor listens to the symptoms of a patient, they are very eager to write a prescription and diagnostic tests. So that leads to multiple, complications, and that's why people have a lot of, issues. So we also will be enlightening doctors, and then we will sensitize them that nutrigenomics is not here to, sort of reduce their business, but to enhance their business, because people who will be flagged with risk factors will be now wanting to do a diagnostic test more frequently to monitor their risk factors and take treatment. The best thing is that the patients would have an accurate, precision line of treatment with which they'll get better results. And at the end, of course, human beings are still the same. In spite of knowing a lot of knowledge, they still don't implement. So you're going to have enough customers or patients for the doctors also. They don't really need to worry. But then this is exactly what we are doing in the next 2 months. So Vignet has been a platform for us to educate people who are interested in nutrition from a genetic perspective, so that they could be nutrigenomic or genetic counselors, and we actually call them genomic wellness consultants, so that they can give a little basic layman language and sensitize people about the importance of taking gene-based dietary interventions, and also paying attention to the lifestyle modification. So that's you can go to our website called mywignet.com. You'll be able to get all the syllabus and all the other details there.
Right. Okay, that's good. I think that was covered very much in an elaborate manner, and I think definitely we'll check it out. It's very impressive. I think, we need that in this day and age, like to be, relevant with what's going on. Don't you think? I mean, it's very much with what's going on, around us. Also, I see Ms. Anu Mahajan's hand was raised for quite some time. Do you have any questions, Anu?
No, ma'am, it was accidentally.
Okay. Could you please repeat the
The website mywignet, www.mywignet, wignet.com. You can just search mywignet and you'll get the URL. You can go there, you can study, you can actually read a section called What Students Say. There have been a lot of students. We have had students from UK, from Gulf countries. One of the students is here online right now. We had in this batch, we had students from Nepal, from Mexico, and most of them are Indians. So they all have given their feedback as to what do they feel about this course. I actually lost 12 kgs in around a month's time by following Reena's diet. Reena is here online. So I asked her to give me a diet, and then she gave, and then I said, look, I would like to religiously do it. I did it for around 15 days. I could see my trouser getting loose, and I was losing inches, and I lost that. A simple diet plan and some lifestyle changes, nothing major, but the results are for everybody to see. Thanks, Dr. Usha, for asking that.
All right, amazing. So, any other last minute thoughts? If not, then we can conclude this seminar. And it was a very, very interesting seminar, in my opinion. And, I hope all of you enjoyed the seminar, and few to say, but so many take home points from this 1 hour seminar, that was so meticulously organized and prepared by the nutrigenomics team at Welocity. And Stan sir, you guys were brilliant. Your team and all of you were so good, and took out time to prepare the slides, and a lot of preparation I could see has certainly gone into it for today. And thank you so much, and we would love to talk further about internship programs and the Vignet program, and your and hope the association is fruitful for the future too, and that's my honest hope.
Surely. Yeah. Thank you on behalf of thank you on behalf of Welocity Genetics and all our counselors here. That's Reena, Lavina, Riddhi, and Rhea Doshi. We would like to thank you for giving us this platform and an opportunity. It's a matter of pride and a lot of fulfillment for us to associate with the University of Symbiosis, and we look forward for a meaningful association in the future as well. So thank you very much.